Okay. Hello, everybody, and thank you for being with us here today. I'm Henry Young. My pronouns are he, him, and I am the Communications Director of OutCare Health, and I'm joining from Los Angeles, California. Thank you for joining us for OutCare's OutTalk series, a webinar dedicated to discussing diversity and intersectionality in the LGBTQ plus community. We have people joining from all over the world today, and we really want this to be a safe and welcoming space for everyone, so please feel comfortable asking any questions you have today, either by typing it into the chat or submitting it to the Q&A. All Out Talks are recorded and can be watched on our website as early as next week. I'm personally very excited for this Out Talk, LGBTQ plus aging across communities and continents. We have some very inspiring folks joining our panel today who are doing incredible work all across the country and the world. And I wanted to thank our moderator today, John. So John, please take it away.
Thank you so much, Henry. And it's lovely to have you all join us today. And I'm excited to have this panel conversation as well. So as we're getting started, as Henry mentioned, there will be space for questions along the way. So if something comes up, please feel free to open your Q&A, put in there, and we'll try and address them as the conversation goes on. But I'm excited to introduce our panelists. Well, actually more excited to have them introduce themselves, learn a little bit about who they are, the work that they do, and they're getting a surprise bonus question right here live on the air. And that question is, there's the meme right now about, oh, I want a sweet treat. Well, if after we're done with the recording today, you were able to have a sweet treat, what would your sweet treat be? So with that as our bonus question, Marianne, why don't I have you introduce yourself first and share a little bit about the work that you do?
Certainly. Thanks so much for having me. I am happy to be here, Sadia, and with you, John. Um, this is my first time in the space with out here, so I'm excited. Um, I move in the world as a Black lesbian feminist. I am also a partner, a sister, an aunt, a neighbor, a community member, an activist, an advocate, an organizer, a visionary, a dreamer, and someone who fiercely believes that the only reason we are on this planet is to help one another. Why else are we here? I am the founder and executive director of Zami Nobla, the National Organization of Black Lesbians on Aging. We are based in Atlanta, Georgia. We have, with state chapters in Georgia and North Carolina, we have members in 21 states across the country. We are the only national organization expressly building power for Black lesbians over the age of 40. We center advocacy, education, and community engaged research. And we have quite a few initiatives going on that I can certainly talk about later. But one of the things that I'm very excited about is that we just started a band called the She. With four of our members who range from 49 to 55. Two of them play ukulele. One plays bass and the other one plays guitar. And the She stands for the Sister Harriet Ensemble, named after Harriet Tubman. And so we have a band. How about that? So I'm excited about
Love
that.
it.
And I can talk about some of the other work we're doing later. In terms of a sweet treat, it would have to be black walnut ice cream.
Ooh, I
I
like
love
it.
ice cream. Yes, it would definitely be black walnut ice cream.
I love it.
Lovely. Thank you. And Sadia, would you like to share with us as well?
Sure. My name is Sadia Abjani. I use she, her pronouns. I am a Pakistani Texan, the daughter of immigrants. My parents worked very, very hard and sacrificed so much to get me here, and I'm very proud of them. I am a queer woman. I am a sibling to a trans sibling. I am a big nerd. In fact, I am taking a break from an all-day D&D game to do this session. I'm very happy to do this session. And professionally, I work at an organization called SAGE. SAGE is the country's largest and oldest organization focused exclusively on LGBTQ plus older adults. My particular department is called SAGE Care, and we train elder care providers across the continuum of care. So everybody from PTOT rehab services, financial planning firms, lawyers, adult protective services, all the way to long-term care, assisted living, hospice, and funeral homes on how to work and care for the LGBTQ plus older adult population. My job is to build those trainings, administer those trainings, and I've been working with SAGE for this December will be 10 years. And it's the best job I've ever had. So that's what I do. That's who I am. And as for sweets, for all the South Asians out there, there's a sweet called a peda, P-E-D-A. If you ever go into an Indian sweet store, ask for a peda. It has like a fudge-like consistency. It's made of milk solids and it tastes like cardamom and saffron. There's a yellow one that has like mango and saffron in it, and there's a white one. The white one's better. I don't care what anybody else tells you. The white one is better, and it is so good. It is my Achilles heel, that and mangoes. I cannot resist it. Doesn't matter what diet I'm on, can't resist it.
I love it. Thank you for taking time out of your game. I hope you don't lose points while you're here.
No, they're waiting for me. It's actually funny enough. It's my bachelorette party today. So we're playing an all-day game because I am 37. So we don't do what the other kids do. We play board games all day and role-playing games all day. That's what we do.
Well, thank you for taking the time out of this beautiful day
It
today.
is
It's
my
lovely to have
absolute
you here.
pleasure. That's how happy I am to be here.
Thank you. And my name is John Sovek, and I'm a therapist here in Pasadena, California. And I specialize in working with LGBTQ adolescents and their families during the coming out process. I've also been working in the HIV and AIDS field for almost 38 years now. I just was asked to do a keynote at the California Endowment, a big retrospective of kind of the effect of HIV on our community. And it was very powerful and very emotional for me to do that retrospect and look back at how long I've been doing this work. Um, I'm also the author of a book called Out, a parent's guide supporting your LGBTQ teen through coming out and beyond. And I've been part of OutCare Health now for, I think, almost 5 years. It's a really wonderful organization. I believe so much in the work that they're doing. And Marianne, I'm with you. My sweet treat is ice cream. It's always ice cream. And my husband
Yes.
knows if I'm actually not feeling well, if I refuse ice cream. That's the sign. He's like, you don't want ice cream? It's like, no. He's like, you are not feeling well. So that's how we communicate that. I think it's, as we're kind of pivoting into our conversation today, I think it's really important to really look at the idea of aging in the LGBTQ community, kind of as like a community based experience that is often marginalized. And I'm just wondering what your thoughts about how you see aging taking place in the LGBTQ community, just as kind of a global meta conversation to start us off today.
Sadia, you want to start?
Sure. So, as we're taking a global look at aging in the LGBT community, I think we're looking at a few things. I'm going to start by saying that we're working and thinking about a community that has worked hard for everything they've accomplished and achieved, worked harder than they should have to, for every right, every thing that we call a privilege, but is actually just a human dignity that our older adults have achieved. And so when our older adults are facing the idea of being forced to or having to accept care from an industry or a community that traditionally was not there to care for them, right? We're talking about the healthcare industry. We're seeing folks refuse care, delay care, or go back into the closet while receiving care, right? Which can be incredibly dangerous because there are healthcare disparities in the LGBT community. There are things that providers need to know if they should so choose, if they desire to do so, if they're open to doing so. There are things that they should know about the LGBT community to make healthcare more accessible and better all around. I think we're looking at a community that has had an incredible amount of employment discrimination, an incredible amount of legal discrimination. So we're talking about a community that, while I don't want to generalize, but statistically has less access to financial funding to go to, long-term care communities that have done the work to be more inclusive, right? So we need a lot of our smaller, what I like to call mom and pop shops, right? It's a little heteronormative, but our smaller organizations to do that work too, but they have to be funded to do so. So I think globally, what we're looking at is a community that has worked harder than they should have to, has achieved an incredible amount, and is now at the precipice of needing a certain kind of support and partnership and help from the healthcare community that many of them are not finding. So my work, my goal is really about how can we bring the healthcare community to a space where they are partnering with our LGBT older adults, because they are the experts on their care. They've been caring for themselves forever because no one else was. So how do we build a healthcare community that is working in partnership with not victims, but advocates and achievers and goal-oriented individuals, amazing individuals who have struggled, who have strived, and who are at a place that need partnership and not help, I guess.
Well, Saudi and John, we know that there's actually no exact counting of how many LGBTQ elders there are in this country or globally. We know for a number of years we were not counted in the census. We know that for the areas in which there's a dearth of research on LGBTQ elders, and even more on LGBTQ elders of color, which is why Zaminola started collecting our own primary research, because we knew that if we did not do that, it would not be done. We know that there is an estimation that LGBTQ elders are someplace between 2.3 and 3.7. And certainly, we know that elders do not feel safe in even being counted. So we will never, ever know that exact number. LGBTQ plus elders face significant barriers due to a lifetime of systemic oppression. In healthcare, we often encounter providers who are untrained in LGBTQ cultural humility, and I will not use the word competency. I will always use the word cultural humility. And that can lead to misdiagnosis. It can lead to dismissal, or in some cases, just outright hostility. In housing, we confront economic instability, insecurity, and then there's also discrimination in elder living environments. Many older adults who identify as LGBTQ, often avoid these traditional elder care spaces out of fear that they will be forced back into the closet. And in Metro Atlanta, which is considered the mecca for LGBTQ folk who flee from rural areas into the city, I have personally witnessed activists that I knew who have moved into these facilities who have gone back into the closet. And it has really, literally broken my heart. And as far as community support, I started Zambi Noble in 2011 uh, because Black lesbians who I'd known for years, as well as other LGBTQ older adults, were really disappearing from the Atlanta social scene. And I wondered where they were. Were they disappearing because of health issues? Were they invisible because they had left the city? Were they simply going in because they were in relationship? And we know sometimes when we get into relationships, we disappear for a number of years. But what I found out was that they did not feel welcomed. Atlanta is very much centered around the youth, and they would go into these spaces and they would be told, "We don't want you here. Why are you here? You're too old to be at this club. Are you too old to be at this social scene?" And so we're talking about a demographic who has built this movement. We're talking about a demographic who has wisdom and knowledge. We're talking about a demographic of folk who absolutely at this point in our lives need to be embraced by our community. And so, in terms of community, I think for LGBTQ elders, especially those who are estranged from biological families, many face social isolation. And then there's just lack of access to any kind of culturally competent services and peer networks. And so, when we talk about the intersection of race, geography, class, and age, these challenges are even more severe at those particular intersections. If you're a Black lesbian elder living in North Carolina, and we do have many who are in rural areas in North Carolina who are in their 80s who are living alone, um, you're really going to face a lot of compound barriers due to the homophobia and the racism and the limited healthcare facilities. And what we don't often talk about in our communities are poor and working class folk. What you see in terms of images, or you see all these rich white gay men, on TV, in print. But the truth of the matter is, we have a lot of poor white working class gay folk too. But these people are invisible, they're hidden. So I think that's something that we need to bring out of the closet. We need to talk about those inequities within our own communities.
And Marianne, I want to just grab hold of that too, because in some ways, I am that demographic you're talking about. I'm a white gay male who has a social economic status that's pretty high. And if you look at the healthcare system, it was built for and around me, not just including the access to care, but also the LGBTQ medical studies that were done for quite a long time. And even early HIV research was all done for people whose bodies looked like mine. And I feel like we're still like flooded by that we have not been able to overcome that and create access to care for larger communities as a whole. And when we look at discrimination, especially for elders in healthcare and social systems today, what kind of things are you hearing about? What kind of things are you witnessing from the people that you're working with?
Sure. So I would love to first comment on, the point that Marianne made. I think that, when we talk about the needs and experiences of LGBTQ plus individuals in general and older adults in particular, I think we still have to keep in mind those systems of power. When we think about who's in the room, who's able to have their voice heard, who's making the decisions, oftentimes it is individuals who look like you. And so when these studies are done, when this research is done, when these decisions are made, or these suggestions are made, or even these cultural competency trainings are developed, right? Who is it that's actually, the voice in the room? Who's being listened to? Who's being heard? And I think what we find in this industry is that often the loud voice is the person who's able to have their voice heard. And that's not often people who look like me or people who look like Marianne. So, Marianne, I just want to uplift the work that you're doing and say I'm honored to be in a space with you. Um,
Thank you.
so your question was about, can you tell me your question again? I'm sorry, I got a little starstruck with Marianne here. So would you give me your question
We're really
again?
kind of looking at the layers of discrimination that have played out over the course of a lot
Sure.
of people in the community's lifetime, and how that discrimination is showing up in their access to healthcare or social services, either experiences from your own life, if you're willing to share, or things that you're
Sure.
seeing that clients are facing on a regular basis.
Sure. So I'll give you a story that happened with a client that we were working with. So what I see on a regular basis in my work and in Sage's work is exemplified by this story. So we had a trans woman in long-term care. She was experiencing cognitive decline, and her daughter would come in every other day to make sure that she had nail polish on, that she had a dress on, she had her pearls on, her hair was done, and her daughter had to move away and asked the nursing facility to abide by that directive and make sure every other day the nails were painted. And while the daughter was there, like every other day, she would notice the nail polish would disappear when she'd come back to visit her mother or her parent. She would notice that, the pearls would be back on the shelf somewhere, or the individual would be put back into a dressing gown. So she was there kind of enforcing that directive. When she left for work, and was gone for about 6 months, the individual declined severely, drastically, was no longer able to speak, and was no longer had longer periods in like a fugue state, was not able to communicate. And then the daughter came back and started enforcing that directive again, right? Making sure that the individual's nails were painted, their hair was cut and styled and curled, and the pearls were on. And all of a sudden, this individual, after a week or two of that, was able to speak again. That's not, a coincidence. It's not happenstance, right? When an individual is able to connect their external body to their internal understanding of themselves, that is healthcare. And what we see in the industry quite often is those essential, pivotal, important pieces of ourselves as queer people, as LGBT people. When those pieces of ourselves are denied, it impacts our physical health. We cannot deny that. We see that day in and day out. And when we think historically, right? My personal example, I was raised by an alcoholic father, right? And growing up, my dad and we have a great relationship now. Everything's wonderful, everything's fine, but I can still trace back my decision making in certain situations, even as a 37-year-old, to growing up in that household. Right. So when we think about LGBT older adults who've grown up, even if they are out and proud now, they, walk into every situation as themselves, and they do not bow down or kowtow to anybody, right? They are still products of a system that did not recognize them, that dehumanized them. And that has an impact. It doesn't matter how old you are. It doesn't matter, where you are. It doesn't matter how your relationships are. It still impacts you today. And we see that impact globally, right? So one example I'll give, and then I'll stop, is that I was doing some research on LGBT laws in Canada. And what I found was when the US, when President Eisenhower called for the dismissal of homosexuals from government service, right? Canada, 2 years later, enacted the same law because it was World War II, or sorry, it was the Cold War, and they were afraid that their people would not be able to speak to American people if they were LGBT, and so they enacted the same laws. So we see this not just in the US, we see this on a global scale, right? And that's just one small example of the impact of the United States's LGBTQ laws. Lavender scare, exactly, someone put it in the chat. That's just one impact, right? But we see it globally. So I think that when we look at historically, when we think about that landscape, one important point that I want to make sure folks walk away with is it does not matter how old you are. It does not matter how far you get. It does not matter how much therapy you've had. We are still affected by those things we've experienced. And we look at this from a historical perspective, we are still impacted by those historical traumas, by that ancestral trauma. And that never really goes away. We're able to deal with it. We're able to understand it. We're able to work with it and turn it into a strength, right? But it never truly leaves us.
Totally agree with everything that you said. It certainly resonates with me on so many levels, Sadia. And we know that many LGBTQ elders just really carry deep-seated mistrust of institutions.
Mhm.
When you look at Zami Noble's membership and our board, we have a 38, 39-year on our board who is amazing, social worker, by the way, who works with the aging population. But our membership ranges from 38 to 90. And many of those women who are in their 80s and 90s, they witness all kinds of social movements and political movements in this country. I mean, every single thing, because they were born in the 30s and the 40s and the 50s. And so they remember being pathologized as mentally ill, criminalized by for their identities, or just outright denied care. And for Black LGBTQ elders, this mistrust is compounded by generational trauma from medical neglect and racism. And I'll just insert a personal story at this point. I was born and raised in Mississippi, in North Mississippi. And I remember going to the health clinic because we were not able to access private physicians who were all white and male. And I remember distinctly, I'm 70 years old. So this was not something that happened to somebody. No, this is very recent. I mean, I'm here to tell a story. Going into the clinic, and there was colored, labeled, white. Of course, we had to go to the colored side. I've drank from the colored water fountain. Movie theaters, we had to go up into the balcony while the white folks sat down below, and we would throw popcorn and peanuts at them. I'm surprised we weren't arrested. Um, and, I have a severe fear of the dentist because at that time, heaven forbid, if you were ever able to go to the dentist, then they would just pull your teeth. I mean, there was no uh, thought or care of trying to preserve them. You barely got any pain medication. And I remember being in ninth grade, and I had classmates who had full sets of dentures. This is really the honest goodness truth. I tell that story now, people are just shocked, but it's absolutely correct. And so it's no wonder that, you fast forward, 20, 30, 40, 50 years, and you have Black LGBTQ folk who, when they do go to doctor, they are not seen, they are not heard, they're invisible, they're dismissed, they're demeaned, and so they don't come back. We have a Black lesbian cancer support group, and one of the only one there's, which is a shame, but the one of the women told me that when she went, she said, "I'd like to get a support group for my partner, for my wife," and they said, "We only have support groups for husbands of our female patients." And so we have no such thing. This happened in Metro Atlanta. So you can imagine if this happened in Metro Atlanta, what's happening in South Georgia and these other rural areas that are not Metro Atlanta. And so, of course, she didn't go back because why would you go back to a medical environment where you don't feel safe, you're not seen, you're not heard, and you're not cared for or about? Um, and, in 2014, Zemi Nobla conducted our first primary data set. And it was with 101 Black lesbians here in Atlanta from 40 to 90. And the most salient issue that emerged from that research was the need for holistic mental health interventions. These women were very well educated, but they were unemployed and underemployed. Over half of them had some kind of disabling condition due to systemic inequities, health systemic inequities. And so, what did holistic mental health interventions look like for them? As evidenced by them, it looked like laughter and joy and sex. It looked like intentional housing on all levels. It looked like intergenerational conversations and communities and engagements. And one said specifically, "I don't want to be shuttled away to some senior facility playing bingo. I want to be at some safe space that's beautiful with flowers and color. I want to be tutoring some young queer woman's child. I want to be teaching them how to quilt. I want to be doing storytelling. And I want to be able to go to a clinic where everything I need is there." This is what, for us, a thriving quality of life looks like. When you listen to the people, we can tell you what it looks like. Ask us. we're competent. We are smart. We know what we need more than anybody else.
Mhm. And one of the things that we've been very aware of in so many of these conversations when we're talking about access to LGBTQ care across myriad communities is this idea that the biggest reason people do not access care is because of negative previous experiences.
Mhm.
And it's one of the hugest blocks we have to trying to create systems of care for the LGBTQ community. So, with that said, we have a lot of providers who are listening with us today, joining us with today. What maybe are some practical things that they could start bringing into their offices to create a space that was more affirming for the aging LGBTQ community? What are some practical steps they might be able to bring into play?
So I can get us started with like a few small things. The first is knowing language. It sounds like it's incredibly small, but it's very meaningful. When I look for a provider, I make a phone call, and if someone is struggling with saying the words LGBT, I hang up the phone and I try somebody else. So getting comfortable with the language is one of the big first steps. The second thing is, what do the forms look like? Do they recognize that I exist, that my partnerships exist, that my chosen family exists? Do they recognize that this is not the case for me, but for many people in my community, do they recognize the fact that I may not want my next of kin knowing any information about me? Do they have that kind of paperwork available? When I look at their website and their marketing, do I see people of color? Do I see, queer relationships? And I mean, we really, you really don't have to be the unicorn rainbow society of awesomeness. You just have to show two women together or two men together enjoying a task of some kind, and I'll get the picture, right? Um, when I meet with a provider, right, are they willing to listen? Are they willing to hear about the things that I've been through? Are they there for 5 minutes, or are they there for 30 minutes? Right? Even getting 30 minutes with a provider these days is a big win, unfortunately. So, are they there to listen? Are they there to spend time with me to understand me? When I'm thinking about elder care providers, right, step one is doing the work to recognize that LGBT people exist. Step two is, what kind of programming do you have, right? Are there rainbows in your halls? Are there people wearing rainbow badges, or, having little tags on their names so I know that someone is safe to go to and talk to, even if the whole organization isn't safe? I don't have rose-colored glasses on. I know it's hard. I know this is a bad issue or a big issue, and a hard issue. So, are there some people that I can talk to? When they have programming, is it just, drag bingo, or is it more like meaty things? Nothing wrong with drag bingo. I love drag bingo, but sometimes people think that the joy is the end all be all. And really, we have to sink into the rest of it too. Joy is wonderful, joy is beautiful, but there's so much else. There's so much brilliance and resilience and love and compassion and history and knowledge. Have you tapped into any of that? Right? Um, are your LGBT events only on Pride, or are they year round? Right? Can I walk into your book club and see the books for the year and see, Evelyn Hugo on there, The Seven Husbands of Evelyn Hugo, right? Can I see queer books in your book club? Can I see, an LGBT supporters group, if not an LGBT support group? Right? What are the ways in which you are recognizing LGBT people as like a fact of daily life? What are the ways in which you're recognizing people of color as a fact of daily life? Right? How am I being understood as not a special group or a minority group, but part of the fabric of society?
Mhm.
Absolutely. Affirming care starts with simply being seen. Do you see me
Mhm.
when I walk into that space? When I moved to Atlanta from Mississippi in 1988, and I was referred to a primary care physician, it was a practice of all lesbian MDs. And, of course, that blew my mind because I had never, ever experienced anything like that ever. And I walked into the office and I was completing the form. And the first question said, "Do you have sex with men, women, or both?" That literally blew my mind because I never ever. I mean, the default was that you only have sex with men, and so no doctor had ever had that question on the form. That's really important because in that instance, without even meeting the physician, who I'm still with, by the way, I absolutely felt seen, and I felt like when I walked into that space, I could certainly talk to her. Now, I think it's important to note here that she is a white lesbian. The whole practice was white at that time. Um, our participants in our research studies talk about the fact that it's important for them to have a healthcare provider who looks like them. The majority of patients in this country, no matter what their gender, prefer women. Men prefer women, women prefer women, trans folks prefer women, none, but everybody prefer women providers. That's evidence-based research. Um, and I think there's a reason for that. Um, so certainly, if we could, for me, in terms of therapy, when I got ready to go to therapy, I called around and said, "I'm looking for a Black lesbian therapist." And everybody's like, because you also have some Black lesbian therapists who don't feel safe in coming out. I need to say that depending on where they are. And so they may be in your city, but they may not be out. And we know some of those as well. But it's certainly important, I think, to be seen. It means using somebody's correct name and pronouns, um, and honoring their life story without judgment, and understanding the trauma that they carry. Sadia talked a lot about that, and that's absolutely important. Um, and dignified care means acknowledging their spiritual, the cultural, and the communal needs of LGBTQ elders. One of our members talked yesterday about having an ex who had her listed as her next of kin,
Mhm.
um, and she had to be hospitalized. And her ex was not respected. She was ignored. The healthcare provider said, "I have to call her brother." That's absolutely important. But her brother is not on,
Mhm.
is not listed on anything. So she's totally dismissed because she's lesbian,
Mhm.
disrespected. And so I think it's important for healthcare providers to
Mhm.
really respect people's wishes, listen to them. Perhaps she and her brother are estranged. Maybe they've not spoken to each other in 25 years. Perhaps
Mhm.
there's a reason why her brother is not listed as someone that she feels important to make these decisions, medical decisions on her behalf. Um, so we really do need to have spaces where we can bring our whole selves, and policies, because I'm a huge policies. We have to talk about policy. We have to talk about policies that uphold safety and
Mhm.
autonomy and belonging. That's vitally important. I went to a facility here in Metro Atlanta to do some cultural humility training, and um, the care specialist who called me said to me, um, "We need someone to come and do training. We have a lot of white LGBTQ, but this is a Black facility. We need Black people to come and train." Absolutely. So I go to conduct the training. The director had the entire staff there. Uh, the plumber, the bookkeeper, the accountant, which was amazing. Um, but they had their first white trans person there, and they were misgendering her. They were disrespecting her. And I said to them, uh, we had a conversation before the training about how this was not appropriate. It was disrespectful. They shouldn't, all of these things. And they said to me, "Well, we aren't going to listen to you." The plumber said to me, "We're not going to listen to you unless you talk about God. Where's God in all of this?" And my response was, "I'm really not an expert on Christianity, our religion, our God. I really can't talk about that, but I can certainly talk about uh, sexual orientation. I can talk about gender expression. I can talk about ageism, misogyny. I'm here to talk about these things. Now, because I was a Black lesbian preparing to conduct a training, who's trained as a community social worker, but who's always worked in public health, community public health, I understood acutely what to say to him. Because when you say to Black folk that you don't know anything about religion or God and you're not equipped to talk about that, they don't want you to talk about that. I was very intentional about what I said to him. And so we could proceed with the training because once I said that to him, his arms were folded. Once I said that to him, he visibly relaxed and we proceeded with the training. So I say that because that's a part of cultural humility. That's a part of being a part of that community. A part, I identify as a heathen, although I was raised as Black Baptist, United Methodist, baptized. I mean, I know, the culture. I know the language. I know the behavior. I know all of that. And so in that regard, I was able to really kind of get through to him and we were able to proceed to have that training, which I think is vitally important.
One thing I want to include as well too in this conversation is I happen to have my primary care provider initially through the way my insurance is working. I was just assigned someone and I met with him. And my test question right away that I like to use is like, they're like, oh, how's your day? Oh, great. My husband and I went out to dinner last night, had a great time. I will immediately drop in the husband question. And without blinking an eye, my provider said, oh, so how long have you all been together? Cool. How are things with you and your household? How is the relationship? Like it was this beautiful affirming space. And this doctor is actually still my GP, even though we changed insurance multiple times, because of the fact that he had the ability to connect with me as a human being, not just based on my sexual orientation, but as a fully realized holistic person. And so, for my cis straight providers out there, if you're scratching your heads, you actually have the access to these skills as well too. It is just going back to some of the most basic concepts of how we provide care in our communities. And there are some questions that were posted about the idea, well, how do we find out about affirming caregivers? And that really is what OutCare Health mission is. If you go on the OutCare Health website, you can look at the out list. You can become a provider yourself on the out list. And it's really an amazing resource with providers all over the world now who are there to provide care for our community. And I think that's really, really powerful. I do also want to open up a question that came up really early in our conversation from one of the attendees. And I think it's important to bring into what we're looking at right now. And it is this idea with all these changes that are happening to Medicaid and Medicare right now, it is going to make enormous cuts to people's ability to receive care. And especially because a lot of these cuts are based on LGBTQ identifiers that are being kind of stripped out of the system. So, where do you see communities being able to still come together, or how is this going to affect our LGBTQ population, aging population especially, as they're trying to access care?
Ooh.
Yeah, just a small question.
Well, so you want me to start? Or you want to start?
Please go ahead.
Okay. Well, just yesterday, some members of Zami Nobla were spent a couple of hours on Zoom, really massaging this question and really talking about how we can come together as an advocacy collective and start doing some policy work, to start doing some organizing, some outreach, and most importantly, finding out from our membership, what issues are most important to them. Of course, we cannot tackle everything, but we can certainly prioritize things. We have everything that we need within the organization. We have brilliant women who are trained in every skill set. We have networks of people. We do nothing by ourselves. This is where allies and advocates and family members and other communities and friends have to help us. It has to be about mutual aid. Zami Noble has a house called the Biggest House for Black Lesbian Elders in Metro Atlanta in the working class neighborhood that one of our board members gifted to us. There's no way that we would ever have been able to afford a house. We are not balling in that way. And so we were able to renovate this house by simply going on social media, primarily Facebook, and raising $200,000. And we have pretty much rebuilt this house. We currently have a two white cis women who are architects in Atlanta who are providing free service to us because we just got a grant from Estrella Foundation to add an accessible bathroom onto the house, and we've done that. We've opened up the house, and now we are adding a second bathroom onto the house. And our plan is to put three tiny houses in the backyard. So, because it's huge, we have gardens back there. We have 8 raised beds. Every year we have all types of people to come out to help us plant because everyone loves playing in the dirt. And this is it's all about food justice. It's about housing justice. We absolutely have to help each other, and we absolutely have everything that we need. And it's just a matter, I think, of just getting back uh, to what solidarity means. You know, it means showing up for community consistently, and it means showing up in community. You know, the person who gave us the house is an MD. You know, we have nurses, we have MDs, we have therapists, we have social workers, we have bus drivers, we have Uber. I mean, we literally, y'all, have everything that we need. We just have to believe that.
Mhm.
Not saying that we shouldn't have resources not from the local, state, and federal. I'm not saying that. I'm just saying, in addition to that, we have everything that we need.
Yeah, I think I want to talk about a few things. One, to focus in on what Marianne was saying, we are a community that cared for each other, took care of one another. We have a history of existence through the HIV/AIDS crisis. We know how to care for one another. We know how to protect one another. We know how to harbor and keep each other safe, right? And whatever happens, we'll continue to do so, right? I think the history of LGBT individuals is the history of 2 steps forward and 1 step back. We've been here before and we'll be here again, right? So, we're used to this. We have plans for this. We talk about this every week when we meet. We know what to do, and we have to continue to protect one another, continue to offer each other safe harbor, continue to care for one another. That's what it's gonna take to get through the next however many years, right? We want to say it's just another 3.5 years, but we'll feel the effects for much longer. Um, on a larger level, SAGE as an organization has been very involved in local and federal politics, and was instrumental in passing quite a few or helping pass quite a few state level laws around LGBT Bill of Rights for long-term care. We've been working with Medicare, Medicaid services. We've been working with trying to, I don't know how much I'm supposed to say because we are 501(c)(3), but we've been working to support LGBTQ plus older adults against the unjust laws that are being passed and the unjust executive orders that are being given by this administration. So right now there's quite a bit of work to find alternative funding around healthcare for individuals. We have a program called Sage Collab, which is a program of over 100 grassroots organizations across the United States and Puerto Rico. And the goal is to do exactly what Marianne said. The goal is to be as connected as possible, as in communication as possible, so that in community we can get through this. And in whatever way that Sage, as a national organization with a significant amount of funding, can support grassroots organizations, which are really doing the hard work, right? Person to person, door to door, the ways in which we can do that, we are striving to do so. Significant funding has been cut from our organization as well, and we're trying to redirect whatever we have to the organizations on the ground that are meeting people where they're at.
I want to add to that yesterday during our advocacy conversation, one of our members mentioned what she's calling freedom papers, and she referenced an incident with her son who is Black and who's been stopped countless times by the authorities demanding to see his ID and his passport and his papers. And so we do know that we have a number of folk who don't have passports, who need them, who need to update their licenses and who might not have the ability to pay for that, to do that. So that's something that we can do as an organization. We can certainly help people complete that paperwork. We can certainly help pay those fees because we know that we have, as one of our members mentioned, we have Black and Brown folk from the Caribbean, from places who've been in this country for years and who might not have the citizenship that they need and who could be snatched up at any moment. So we need to make sure that people are certainly quote unquote legal. About last year for 6 months, Zambi Nobley we partnered with an organization called Necessary Trouble, and honor to John Lewis. And we received some funding from the Urgent Action Fund for Women. And we spent 6 months going to do voter education in senior facilities. I want to make sure that we understand that we cannot neglect senior facilities because you have folk in there who are LGBTQ, and we know that, and they're not safe enough. But we wanted them to know who we were so that when we leave these facilities, they can reach out to us. And so we continue to go in those spaces. We continue to go in spaces that may not be traditionally friendly to us, but we need to be able to find our people and they need to be able to find us. We know that we still have people coming out, y'all, who are 60, 70, 80 years old. We have members in their 80s who say to me, I never thought I would live this long, and so here I am. And I don't know what to do. I haven't prepared for this. And so let's just make sure that when people do come out, we have some safe, affirming place for them to come out into, that we have some resources for them, that we are a community where they will feel welcomed and embraced, where they can feel some joy and some peace and some love.
I
And
know that we
what's
only have a few
beautiful about what
minutes.
you're sharing too is today, the day we're actually recording this, July 17th, is Good Trouble Day. It is the day where we are asked to step out and cause good trouble to make change happen in the world. So we're getting very close to the end of our time today. And I just wanted to ask each of you, we love to close with this question. If you pause for a moment and really look at your vision or hope for the future in LGBTQ aging care, what do you see? What do you hope? What is your vision for a future for our community?
I hope for the future. And it's very small. I don't need people to be perfect. I don't need providers to know everything. But what I want from care providers, what I want from healthcare in general, is to learn the ability to be humble and apologize, right? It's a very simple thing, but we often, when we apologize, we over apologize and make it about ourselves. We're all going to make mistakes. No one knows everything. And ignorance is only a problem when it's malicious, right? People don't know what they don't know, and that's okay. We want to welcome people into this work. We want to welcome providers into this work. It's okay if you don't know everything, but learn how to apologize. Learn how to say, I made a mistake. I won't do it again, or I'll do better, right? That's how we learn. That's how we grow. And that's what I want from my providers. I want to walk into a space and know that if someone doesn't know anything, if someone hasn't been trained, they're at least open to trying. They're at least open to learning. And if I give them resources, they're going to go check them out. And if they make a mistake, they're going to apologize. That's really what I want. I don't need people to be perfect. I just need them to be open.
When you raised that question, John, what came to my mind was the quote from The Color Purple by Alice Walker, the movie and the book, where that character says, "All my life I had to fight." I had to fight my brother, and all my life I had to fight. My hope is that LGBTQ plus elders are no longer fighting,
Mm.
that 30, 40 years from now, they're not doing the same work that we're doing. They will have to do their work. But my hope is it's not the same work. My hope is that LGBTQ plus elders are no longer surviving in the margins, but that they're thriving at the center of our communities, that aging is celebrated as a queer act of resistance, that every elder knows that they're cherished and protected and needed, and that we build a future that honors the past while refusing to repeat its erasures.
Man, mine
Beautiful.
was a low bar. I need to desire more. I need to want more, Mary.
And you know what's beautiful is I hear
Well,
them both
I am
weaving
7
together.
years old, Sonia, so that part.
And I hear them weaving together, and hopefully these visions will come true sooner rather than later. And I want to thank you both for taking time out of your busy schedules to share your wisdom and your hearts today and your stories. It's a beautiful, beautiful hour. Just to let you all know who are attending today, it should be available on the OutCare website by next week if you want to share with other members of your community or friends and family. I also want to invite you all to join us in September on the 18th at this same 3 o'clock Pacific time, 6 o'clock East Coast time for our next webinar, which is going to be about Love Makes a Family, LGBTQ plus paths to parenthood. I think it's going to be a beautiful conversation. We're going to be looking at ideas of assisted reproductive technologies, adoption, surrogacy, and inclusive care practices to really bring the idea of creating families for the LGBTQ community. And so please join us then. Let your friends know to join us then. And as I let you all go, I encourage everyone to go off now and have a sweet treat. Good night, y'all.
Night. Thank
You.
you.